The following video was recorded during ArcVic's 2015 OCD and Anxiety Week seminar. To see more segments from this exciting yearly event, or to learn more about ArcVic's helpline, support group, recovery programs, and community and professional education training, please visit the ArcVic website at www.arcvic.org.au.
Moving on to our next speaker, I want to introduce Dr. Louise Cooper. Now, Louise has worked with us as part of our ArtVic family, and she's now working out in the field. She's a counselling psychologist and a director at Emotions at Work, and today she's going to share with us about not judging me, I'm scared, and working with our emotions and how to regulate our emotions when we are in a heightened level of anxiety. So please welcome Dr. Louise Cooper.
Thank you, Michelle. What a fabulous turnout. That's great. And thank you, Wendy, for Horses for Courses, because this is another course that I'm about to talk about. When I was thinking what to call this, I said to my partner, my business partner, I want to call it Don't Judge Me, I'm Scared. And her response was, but what's that about? And it took me 2 days to try and work out what that was about. Why did I want to call it this? I'm not going to go through those 2 days. I just want to leave that title with you for a moment and to kind of percolate, and I'll come back to it at the end of this talk. I'm going to be talking about emotions. I've noticed, I was here this morning, and as we talk about anxiety, we don't often use the word emotion. We don't often talk about emotions in the context of anxiety. I work very much from an emotional perspective, using an approach which is called emotion-focused therapy. And I'm aware that there's a mix of people in this audience. There may be some health professionals that are very comfortable with technical jargon. I'm not particularly comfortable with technical jargon, but you may be there. There are people who are here with their own lived experience. There are volunteers. Everyone's got a different perspective on this. So hopefully I'm going to be able to give you all something, and please ask a question if it doesn't make sense. So, that'll help. Let's try it again. There we go. So, emotion-focused therapy is an evidence-based approach that has been used for many years to work mainly with depression and work with trauma, and particularly work with couples and couples counselling. It's only quite recently that it has been thought that maybe working with emotions, using emotions, if you want, as the starting point, could be useful or effective and helpful for people who are having difficulties with anxiety. So a lot of this is reasonably new, and being led by a guy called Robert Elliott, who resides at Strathclyde University in Scotland, who's done a lot of work in trying to see if starting from emotions and using some of the techniques that are part of emotion-focused therapy is useful for people with anxiety. And what is being found that, yes indeed, particularly with social anxiety, this is a very useful way to approach anxiety difficulties. So I want to talk a little bit about the emotion, the theory of emotion that is behind all this, and then look at anxiety through the lens of the emotion, of the focus on the emotions. And then I'd like to give you the opportunity to sort of pop your toe in the water of doing this and how we start to work in this way. So, you know, why should we talk about emotions? We've got much more knowledgeable, much more awareness now about anxiety and the effect of too much anxiety on people's life and how debilitating and painful and distressing it can be, thanks to organisations like ArcVic. And the more that we know about it, the better equipped we are to be able to work with ourselves. And this includes understanding the emotional component of what's going on. It tends to be at the moment the first stop in what we call treatment for anxiety is cognitive behavioural therapy. And this can be really useful, working with thoughts, really useful. But I'd like to have $1 for every time that I hear someone say, yeah, I know all that, but still. Yeah? I know this. I know what my thoughts are. I do all this, but still. That it's helpful to a certain point, but there's still something going on, something to be grappled with. And there's kind of a big question mark over what this is. And of course, question marks aren't helpful to people with anxiety. So I'd like you for a moment to just use that thinking tool to think about what emotions are actually involved here. The first one that most people come up with is fear. That fear is part of anxiety. And when we talk about anxiety, if you want, as a diagnosis, we will put the experience of fear, of being fearful, as part of that experience of having anxiety. But fear is a separate emotion if we look at anxiety as an emotion as well. Of anxiety as similar to fear, where, and this has been talked about before, where fear is something that is actually real to be feared, whereas anxiety is about something that might be, is the question marks around, is something in the future that we actually don't know about. So we could say, okay, there's anxiety as an emotion and there's fear, but what else is there? I think maybe the first thing that we go to might be anger, that people get angry when they're feeling anxious. Maybe sadness about the whole experience. Maybe embarrassment about it, trying to hide it, which is linked to shame. Let's just start to think about the various emotions that might come in. There may be surprise in there. You know, that sometimes you can do something and you surprise yourself. That working with anger, there's all sorts of things going on. What I call kind of the emotional stew. But I think it's quite easy to see that there's a lot there, and we might not actually know what it is. So going back to a little bit of theory, or some of the concepts around the theories that there are about emotion, and there are lots of theories about emotions, what it is, what emotion is, how it works within us. And I've just picked out a few of these key core things that are used in working with emotions. And one is that emotions are felt in the body. So when we say we have a feeling, we actually feel it. You know, like if I do that, I feel it. I actually feel something. And it's very sort of simple concept, but I think sometimes we lose sight of the fact that when we feel something, it actually is something happening in the body. There is a spot where we feel it. And the more we're able to feel it, the more kind of awareness we have. And Wendy was talking about this, you know, having sort of some concept of our body, of using our body in this. I don't know if people remember the movie Casper the Friendly Ghost. Anyone that's got kids of a certain age will have been subjected to Casper the Friendly Ghost, who basically, as a cartoon, looks like, you know, a blob with a sheet on top, but flies around, and flies kind of like that, right? The head goes, and the body just follows. And I'd like to suggest that that's actually what we do most of the time. We just go off with our head. We're dominated by our thoughts and what's going here, and our body just toddles on afterwards. And we really have no awareness of our body at all. It's just something that gets dragged around. But if we know what we're feeling, and we have emotions all the time, we're having different kinds of emotions, and if we can get in touch with that, we have a whole other set of information. Emotions are messages that tell us things. So if I walk out the door here and cross the road, my body has a response when the car is about that close from, you know, and I'm crossing the road. That there is something, we know, something happens in our body, and we know that. We know what that feels like. We know what it feels like if we get really angry and we get a surge of, you know, heat. We know what that feels like. That sort of stuff is happening to us all the time in different ways, and most of the time we don't know about it because we're too busy being Casper. The thing about emotions which is important is that they lead to action. As I said, we know we walk across the road, so we feel something and we respond to it. We take action because of what we feel. Sometimes we're not aware of that connection, but you know, we're more aware of what we're saying to ourselves in our heads. But there is something happening that makes us take action. And then a big part of emotion theory are arguments over which are the most important primary emotions. And I've listed here, this is 7. Some people will argue there's only 5, and they leave out shame and disgust. These are the emotions, though, that if I was to make a face to depict one of these 7 emotions, you would probably guess what was going on for me. There's a whole raft of emotions that we're not quite so familiar with. These emotions you'll find around the world. They're universal, they're not culturally bound. So if someone's happy, wherever they come from, whatever their culture is, we will see that they're happy because we'll see it on their face. We recognise these emotions. And they're not necessarily the most important primary, but they're the ones that we see most and experience most. So that's just a little bit about the theory behind emotions. Now, when it comes to using some of this theory and trying to work with people and to give people ideas about a different way of looking at their anxiety, their experience of anxiety, as I said, there's always been a thought that a humanistic approach to anxiety is tricky because it's person-centered. In other words, the client or the patient or the person is the centre and can lead where we go in this exploration. Now, one of the things with anxiety is the need to know, and the need to feel safe, and the need to have messages or input from somewhere that lets you know that you are safe. So the idea of someone who's having difficult experiences with anxiety, of actually leading and not knowing where they're leading, could well create a lot more anxiety. You know, if you imagine a therapist and a client, and the therapist sits there and waits for the client to say something. all that might be going on is the client thinking, what am I supposed to be doing? What's going on here? I don't know what I'm supposed to say. What do they want me to say? What's the right thing to do here? Anxiety is likely to build, and then, you know, we kind of withdraw and go into protection mode rather than opening up to this therapist. What's happened with various approaches using emotions now is that there's a sort of recognition that there needs to be some structure. So this way of working has found a structure which is able to hold a person who is feeling anxious and allow them to feel more secure in the whole process. And therefore has kind of opened the door, once that's sort of been established, opened the door to exploring emotions in therapy. In a humanistic approach, there isn't a diagnosis as such. It's about working with a person. So the person does not have anxiety. The person is experiencing anxiety as they may be experiencing fear or happiness or surprise or sadness. Anxiety is seen as either adaptive or maladaptive. Now, anxiety, when I say adaptive, I mean it's useful, basically. It's useful for our society, it's for our survival. So it helps us, you know, you have anxiety, about something, you're concerned about something working in the future, you do what you need to do to make sure that it does work. It's very useful. When it's maladaptive, it's not useful. So sometimes you can prepare too much. In other words, the level of anxiety in preparation was too much, and so you over-prepare and it's never enough. So it's too much. And that's not useful. Maladaptive anxiety often can be, it's not useful because actually there isn't a future thing to worry about. There's something underneath this anxiety. There's emotional stuff happening underneath that is being covered by this anxiety. So the anxiety is there, yes, for a purpose, but the only purpose is to cover up the difficult emotions that are underneath it. So one of the things that we do in therapy working with emotions is to try and identify what might be primary and what might be secondary. In other words, the anxiety is covering up. The anxiety is a reaction to whatever the emotion is underneath. So if it's sadness, for instance, that is so painful that it can't be let out, or perhaps we've learned that we can't actually go to that sadness. Someone somewhere has told us you can't do that. It's not appropriate to do that. So we learn not to do that. Instead, we cover it up with an anxiety, a kind of, I've got to keep this in, I've got to keep this in. So the anxiety is like a layer on top, right? And it's protective. So maladaptive in one sense, I'd argue that it's kind of adaptive in another way because it's protecting us, and that's really important. So I said it's kind of this reactionary thing. It's also the anxiety that is automatic, that we learn very early on in life that that's how to respond, that there is a lot of anxiety early in life, and therefore that is a default position. It's maladaptive. It's not appropriate to present situation. It comes from the past. It's not appropriate now. It's a covering up thing, and it's kind of like a habit. It's automatic. The other thing from an emotion-focused perspective is that when we have an experience of anxiety, what's happening inside us is that, and Wendy referred to the inner critic, that there is a fight, an internal fight between the critic and the person who is actually having the experience of living. So the person who is living wants to live in a certain way, and the critic is saying, you can't do that, you can't do that. There's this internal struggle. And there are all sorts of emotions involved in that, because if you think about the person that's wanting to do something is being told, no, you can't do that. What happens? You know, you kind of recoil. And you might feel perhaps ashamed of the fact that you're not standing up to this critic. There might be sadness about the fact that this is happening. The critic actually might feel ashamed of treating the person, yourself, in this way. There are all sorts of possible emotions and possible scenarios that may be going on underneath the anxiety. We talk about this, you know, as I'm talking about these various emotions and what might be happening in the past and the present and all this sort of, or the whole picture. We call it kind of the scheme, the emotion scheme of what is going on. And we could draw it and link it up and make a kind of very pretty diagram about all the things that are going on here. And then start to really have a look at it and uncover what that is, what the emotional experience is underneath to do this. Now, how the hell can you do that with someone who is experiencing anxiety and is overwhelmed and probably is not taking in a lot of what is being said, and you're wanting them to kind of stop all that, remove all that, let's have a look at what's underneath. Or even saying to them, this is what's underneath. You know? It's not going to work like that. Where would you rather fish? If we're going fishing for some emotion, because we don't actually know what's in there, where would you rather fish? In the stormy water or in the calm water? Excuse me. In the stormy water, you can't see anything. So if you're in a boat and you're looking, you have no idea what's in there. None at all. You can't really go near it. But if the water is calm and clear, you can just have a look. You can look down and see what's in there. It doesn't mean you have to go in there, because I can tell you, if there was a shark down there, I wouldn't go in. I'd be sitting tight on the boat, right? But I might be curious to just have a little look at that shark. I might, if I was being really brave, throw it something and see what happens when I do that. Yeah? I might do that. Probably run for cover just in case it's scary what happens. What I'm saying is that firstly you need to have sort of calm enough water to be able to do that. Otherwise you're not going to be able to go gently. You're just going to get sucked into the vortex of this sort of stormy, rough water. So I'd like to, I know Wendy has done some beautiful meditative stuff with us before, but I'd like to just add to that. We want you to all leave here in a calmer state than when you first came in. That's the aim. Take you through some of the things that we use in emotion-focused practice to try and create safety. Because if you don't feel safe, you're not going to have a look. You're just not going to want to do it. It's like asking you to put your hand in a fire or put your hand in a Rottweiler's mouth. You're just not going to do it. So the first thing that needs to be achieved is to find some sense of safety. And anyone that's willing, I'd like to take you through a couple of the ways that we do this. Some of this will be familiar to people because everything's borrowed, there's never anything new. And some of them are, some of it is kind of little, I don't like to call them gimmicks because that doesn't sound very professional, but little twists to try and help you get to some space of safety. Is there a question? Yeah.
down to this. When you said, told us the primary emotions, you didn't mention love or hate or indifference.
They're not considered as primary because they're expressed in different ways. Doesn't mean they're not important. But in terms of working out how we function, no, they're not in there. And this is exactly what you're saying now, is exactly the kind of thing that would be questioned when someone stands up and goes, there's 3 primary emotions, or there's 5 primary emotions. Well, what about? So I agree with you totally. Surely love should be in there. But fundamental, but in terms of, and this is one of the ways that it's described, if you try and show me love on your face, will I recognise it? That's one of the ways that these have been identified. I agree with you totally. It's primary, but not in this sense. Yeah. Okay. So if you want to sit, make sure you're comfortable in your seat. Put your bum right at the back so it's comfortable, and hopefully you can reach the floor. And if you can't, grab a bag or something. I have this problem all the time. I have to walk around with an old telephone directory in your bag. So try and feel that you can sit there for a little bit. Close your eyes. If you've got stuff on your lap, it's best to put it on the floor so you don't have to worry about it falling off. And place your hands just on your thighs. If that's comfortable. If it's not comfortable, put them somewhere else. And close your eyes, and I want you to take a couple of really deep breaths. And let that first breath out slowly, as slowly as you can. Only if this is comfortable. And it can, when we manipulate our breath, it doesn't feel comfortable because we're manipulating it. But if we want to breathe out slowly, we have to get that air in there to start with. And that out breath, just feel the weight of your body going down into the seat through your buttocks. And just for a moment, we're going to go back to those feet. Put your attention in the soles of your feet. Just notice all the little nerve endings underneath the ball of your foot. They're there all the time. We don't notice them. We're too busy being a Casper. But they're there. There's like a pressure between the bottom of your foot and the floor. Just notice that. And notice the difference between your right and your left foot. And then put your attention into the heel of your foot and notice the difference between the ball of your foot and the heel of your foot, because it's different. There's a different sensation you get there. And then under the arch of your foot, where there's much less pressure, unless you're completely flat-footed. Just notice those differences. And then move up and notice that weight going down through your tailbone, down through your buttock, into the seat. And again, there's a pressure. It's like the seat pushes up and your body pushes down. So just notice that tension that's there. Feel your weight going down. And compare your right and left sides. Because none of us are symmetrical, even though we all like to think we're perfect. Perfection is not symmetrical. And then move up and notice the point where your back makes most contact with the back of the seat. Notice that pressure. And notice one side, compare one side to the other side. Just notice that. Now I want you to imagine that I'm giving you all 6 pieces of blue tack. I want you to put one under each foot, one under each buttock cheek, and one behind each shoulder blade. So you stick yourself to the chair and the floor. And this is really powerful blue tack that I've given you. So if there was a tornado that came through this room, it might shake you a little bit, but that blue tack is going to hold you to the chair and the floor, and you'll be okay. So you might feel the shudder or whatever, but you're still there. It passes and you're still there. Now I want you to take your mind, if you can, to somewhere that you've been to or somewhere that you've imagined. You might have seen a picture on a postcard. Somewhere where you feel that you could just be. It might be on a beach, it might be a forest, it might be in space. It might be somewhere that you just create in your mind where you could just be, you could just plop. And if you've got that place, if you're having difficulty imagining something like that, that's okay. You can just go back to checking in with your blue tack, make sure it's still stuck. Yeah? If you've got that idea of a place that you can be, I want you to try and imagine what it would feel like to have your body there. Imagine whether you're standing there or sitting there or lying there, just imagine that your body is doing that. And I want you to notice what you can see around you in that place. Colours, the light reflection, or it might be dark. Just notice what that darkness is like. Notice what you can hear. Even if it's silence, you can still listen to silence and notice that it's silence. Yeah? And is there a smell to this place? Can you notice any smell? And then come back to that, getting that sensation of being, of your body being there. This in your mind is creating a place of safety. Doesn't mean that you at the moment feel 100% safe, but your mind is going to a place where you can just be with nobody asking anything of you, and you're not asking anything of yourself either. So there's no demands whatsoever. Your body can just be there, doing nothing, apart from taking in the auditory tapestry, the visuals around you, any smells. You're just soaking in this whole experience. Now, if you feel comfortable there, you may want to just quickly scan your body and just notice what's there. Just notice what your throat feels like, your chest, your stomach, your thighs, your upper arms, your groin, your calves. Just notice. If you don't feel comfortable doing it, that's fine. Just go back to your body being in that space that you were. Just soaking it in. And then if you can imagine in between your eyebrows a little television screen. A little television screen with white light on it. It's just sitting there at the top of your nose in between your eyebrows. Nothing on the screen but white screen, waiting for something to come in there. And I want you to push the edges out, make that screen a little bit bigger, make that television screen a bit bigger so the edges go out towards the edge of your forehead. And then if you can, just push them a bit further so the edges actually disappear and you're just left with this white space. It's clear. It's a clear space. And once again, just quickly look at your body. Just scan what's happening there. Alright, I'm going to bring you back to the room now. I'd like to leave you on your desert islands, but we're coming back. So just Take a couple of deep breaths again to connect to your body. You don't have to look at it, just take those breaths, force them, and then wiggle your body, move your body as you open your eyes. Is everyone okay? Now I would suggest, I'm not suggesting that now you are all in a position to go diving into the ocean, but I'd suggest that you might be in a better position or a more comfortable position to even think about doing that. Sometimes working with people in this way, with emotions, it can take weeks before someone actually feels comfortable enough sitting in a room with another person to even think about looking at what's under the surface of the water. And that's okay. It's perfectly okay, because the safety is the most important thing. And a sense of not being safe is such a massive part of feeling anxious. You know, the question marks coming of not feeling safe or what might happen. So to get that experience of feeling safe and knowing that you can get there, this is the other thing, that you develop a habit of being able to get yourself into a place, into a space that does feel safe. So if you put your toe in the water, you can also pull it out again quite easily and go back to that place. Maybe with a bit of work and a bit of guidance and assistance from someone else, you can get out. It's a little bit dangerous, but it's okay because you've got a safety net. So that's what we've just done. That's the kind of the beginning of building that safety net. So what I'm talking about here, the most important things if we're trying to look at emotions and discover what is in there, what is underneath the anxiety, requires a phenomenal amount of empathy. And again, that is something that, however empathic someone might be, it takes a while to trust that. So the process of actually working with a therapist can be really slow because trust needs to be built and safety needs to be built. And the work is not to be underestimated. And often there's a lot of impatience to get to the nitty-gritty, yeah? But you're not going to be able to touch it or get very close if it's too scary, and you're just going to go straight back into, I'm not doing that again. Right? And then working through, as I talked about all these emotions that are involved in it, having a look at them, just a little look, experiencing some of them when you have a look, of recognizing it and kind of realizing this is part of the experience. It may be now, or it may be an experience that's held from the past, but being able to feel safe enough to have a look, and to be able to have a look and come back to now and walk out of a room and carry on with one's life, requires a lot of trust and a lot of sense of safety. And then in there with the emotions, often there's unfinished business, which is why the emotions are hanging around. These emotions got there and got stuck in some way, in some process. And that process needs to be unpicked. Just give you an example of two people go to a party. Let's call them Pat and Charlie. Charlie's at the party first. Pat walks in. Pat's been away for a while. Says hello to Charlie. Charlie's really pleased to see Pat. And then Pat, who's been away for a while, goes and speaks to someone else that hasn't seen for a while. And Charlie starts to think, Pat's not my friend anymore. Goes home that night. Pat's not my friend anymore. Pat doesn't like me. That's because I'm unlovable. Nobody actually really likes me, including Pat. I thought Pat was my friend. Anxiety speaking. In fact, let's just hypothesize here. It may be that Pat actually felt very sad when Pat moved on to someone else, felt rejected and sad. It was nothing to do with anxiety, it was just sadness, except for that wasn't seen and acknowledged because there wasn't it didn't have an ability to go, oh, I'm feeling sad. Went straight into anxiety as a habit or as a cover-up because the sadness is too painful. Yeah? It's a simple example. And we call that an interruptive process. When something interrupts actually what is really going on, it gets interrupted, and anxiety seen as a way of interrupting what is going on because it's too hard or too painful is a very useful way of thinking about it, and it allows you to say, maybe there's something else here, and I was just interrupting that because it was too hard. So echoes of the past, the self-critic in the present, it's really complex. We're not talking about something that's simple at all. It's complex and it's individual. So I'd like to bring you back to this statement, don't judge me, I'm scared. What emotions are involved in that statement? It could be that I'm standing back here. Don't judge me, I'm scared. Okay? Don't judge me. The emotions involved. Don't say that about me. It's a very painful phrase, but nevertheless, I'd suggest that there are about 5 emotions or 6 emotions that could be contained in that one sentence. It's not just about being scared, it's about being anxious, it's about being angry perhaps, it's about sadness, it might be about shame. And it can also be about happiness and surprise when we learn actually what our experience is. So just to finish, because I need to finish, the whole purpose to this was to introduce you to this idea of not forgetting about emotions, the emotional component of your experience. Don't become like Casper and get dragged off, flying around the world without taking your body with you. Thanks very much.